And that's Dr. Krishna Prasad Kudlu, Smile versus PRK versus LASIK, which one is good for the patient? So let us hear from him. We know that you do a lot of Smile, Kudlu. So I have a feeling you're going to come out with, Smile is best for the patient. But
Thank
anyway,
you. Thank you, Namrata madam, for
but anyway,
the
let's uh,
introduction.
let's hear your talk. Dr. Kudlu needs no introduction. Medical Director of Prasad Netralaya, Super Speciality Eye Hospital, Udupi, Mangalore, Sulia, and Tirathali. And we also he's the scientific committee member of the All India Ophthalmological Society. And more importantly, we always enjoy his meetings that he does in Udupi and in Goa, etc., etc. And we look forward to it again in the coming years. Thank you so much,
Yeah.
Guru.
Thank you, Namrata madam, for a wonderful introduction. In fact, I would love to do more and more this kind of meeting. Hopefully, I think COVID will end and soon we'll have one more beach festival as early as possible. Once again, thanks for the opportunity. I'll be talking about PRK versus LASIK versus Smile, which is best for the patient. I think most of the things has been discussed by the previous speaker. I did not have to talk much about each procedure, but we started with the surface ablation. Later on, we went on to do a LASIK procedure, and then later on comes the customized treatment. Then come the femtolasic, then up to the Smile. But still now, once again, most of the surgeons been now once again changing over to surface ablation. Of course, as we all know that surface ablation started way back 1990, then become little bit unpopular. But now if you can see lot of advancement happened in the technology of the surface ablation, that makes the surgeon more and more comfortable and risk free. So these are the few indication, real indication where we opt for surface ablation, especially in case of thin cornea. Very important, people with the larger pupils and patient with the even epithelial basement membrane disease. Even he can combine with the bioptics also. And of course, as Dr. Chitra madam said, that one of the very good treatment, especially for top-up correction for residual refractory error. So this I'm not going to talk about. There are different methods to actually take out in PRK to take out the epithelium. Uh, but I think some of us, I think, been doing a LASIK procedure with the help of 20% dilute alcohol. The loosened epithelium will put a sidewise, then the stroma will be treated, then later on epithelium is replaced. Of course, epilastic, few of the machine, especially Moria, with that you can still perform this epilastic. I don't have much experience with this. So these are the few problems with the PRKs, I think mainly with the corneal. These are the pathophysiology behind PRKs. I am not going to discuss much about this. I think previous speaker might have already told. But very important, why people really doesn't want to do the PRK, because of the pain management. Some of the sensitive patients are really, you take out your time, keep calling you up to 48 hours, they'll have a very severe pain. Of course, my friend Rohit Shetty has been trying with the ketorolac soaked BCL. He has been putting over the PRK patient. He tells that the pain is much lesser with these patients. Of course, now I think most of us, I think everybody using this topical mitomycin after PRK, especially the thumb rule is 0.02% for 10 seconds for every diopter. If you want to do a secondary procedure, I think you have to put it for 1 minute. Of course, management of post-haze is also very important. I think you may have to tackle them in the steroid. Let me come to the LASIK. I think most common elective surgery procedure performed in the medicine, and probably every patient come to us, whatever the ornamentum you are having, still they come with, they want to get with the name of LASIK. So there are few problems with the LASIK which has been overcome by the femto second LASIK. The advantages are much with the femto LASIK, especially you can really plan with the better flap thickness and lesser variation in the intraocular pressure during the surgery. Even compared to the blade LASIK, chances of dry eyes is much lesser, and even can be safely done also. Even there are few issues with the femtolasic patient with the even come with the DLK, even OBL, even increase the duration of the treatment. So I think Relic Smile I've been doing since last 7 years. Already Professor Titial sir already showed about his experience and how easily he can do. Basically, it's a single step procedure, flapless. So no ablation, no flap, and with the all femtosecond machine, probably Carl Zeiss Visumax. Now, couple of companies also come up with the same procedure. The advantage is basically it's a very soft, safe section. The cone is physiological, no need of chaining the station, and a very soft laser. So I think all this part I am not talking, but if you, these are the few small advantage, less energy on the cornea, especially when you're treating a very high myopia. This is very important with the less induction of the spherical aberration. There's a few advantage. Some of the studies show that a higher biomechanical strength, so chances of ectase are much lesser compared to the any of the procedure. Of course, most of us been doing this procedure. You can do the incision between 1 to 4 mm, and normally the patient get back to, if your manipulation is very less, they get back the vision immediately. But what are the issues with this? Of course, still very high astigmatism, sometimes chances of undercorrection. I think newer machine may come with the cyclotorsion compensation, but the older machine doesn't have this. Of course, we are still waiting with the hypermetropy correction that I think yet to come. So let me come to a comparison between SMILE versus LASIK versus PRK. If you think about higher order aberrations, spherical aberration, in SMILE, definitely there are a lot of studies you can see down here, significantly much lower compared to LASIK and PRK. When you think about post-surgery regression, I think you all agree. I think the post-surgery regression is much, much lesser in SMILE in comparison with either LASIK or with the PRK. Even with the PRK is okay, but if you compare with the SMILE, definitely SMILE has got advantage. Of course, if you think about dry eye, of course, PRK and SMILE will have a same score over each other. But if you think about SMILE and LASIK, I think definitely because of the lesser damage to the subbasal nerve layer, normally the chances of dry is much lesser, and even patient have a better post-op and corneal sensitivity. When you think about the corneal biomechanics, there are a lot of papers you will get in the journals, but I think some of the study really show that less biomechanical effect on the corneal integrity compared to LASIK. So this is because of the what we do. So one more thing what I want to tell here, tissue evacuation in SMILE happens to be considerably more deeper than the PRK and the LASIK. Compared to PRK, ablates always Bowman's and the anterior stroma, which is the more stronger layer of the cornea. So if you see all these comparison, I don't want to discuss few of the cases, but I think definitely most of the cases, SMILE has got a definitely better advantage than the other procedure. Once again, I thank Namrata madam and the whole team for this wonderful opportunity. Thank you, one and all.